Over 36 million men experience erectile dysfunction, yet it's rarely talked about. That's why I've partnered with Mainspring Medical to feature the Vacurect, a device that uses negative pressure to draw blood flow into the penis, stretching and oxygenating the tissues. The Vacurect device is designed to improve your sexual health, taking the pressure out of your head and putting it where it counts, in your penis. Click the link below to discover how the Vacurect can enhance your sexual pleasure.
Here are a few exercises to try if you have pudendal neuralgia. Our first exercise, we're going to come to all fours. So hands and knees, position. And this is called cat-cow. So you're going to drop your belly, point your tailbone up toward the ceiling, and look up. Take a breath here. Notice, do you feel a stretch in your butt area, around that pudendal nerve area? And then you're gonna tuck your belly, tuck your chin, and push your spine up toward the ceiling. And then back down to dropping your belly, pointing tailbone up and looking up. Take a couple of breaths in each position before you switch. And you'll do that as many times as you feel comfortable, and as long as you're feeling that stretch. Our second exercise we call rock backs, and we'll rock all the way back into child's pose if that's comfortable for you. So again, we'll start hands and knees. And we're just gonna start by gently rocking back and forth, back and forth to your comfort level. And if it's comfortable for you, you can rock all the way back. You can open your knees as wide as your mat, walk your hands forward, and bring your forehead down to the mat. And in that position, take a few deep breaths. Really feel your breath all the way down into your belly, maybe all the way down into that area of the pudendal neuralgia. We're really creating movement, blood flow, and space around that nerve to give it some relief. Again, with this exercise, you can do as little or as much as you would like. Our third exercise, we're gonna flip over to our backs. If it's uncomfortable to lay flat on your back, you can put a towel or pillow beneath your low back, or you can bend your knees up like I am right now. So I'm gonna lay flat on my back with my legs straight. I'm gonna bend one knee up and just gently pull down. Take a couple of deep breaths here. And then switch. And here, notice, does one side feel different than the other? Just notice the different sensations on each side while you breathe. And our last exercise, we're gonna bring our knees up, bend our knees up, keep our feet flat, and we're just going to gently windshield wiper our knees left and right. So we're gonna start with a small movement and gradually make that movement bigger and bigger. And if it's comfortable for you, you can come all the way down to one side and hold. Take a couple breaths here. And switch. This exercise can also be done in sitting. If you're not comfortable on your back, you can sit with your knees bent and just gently windshield wiper knees left and right. So those are exercises to help with pudendal neuralgia. As far as how often should I do this, do a little bit, a lot. You can do this several times throughout the day. It's normal to feel a little bit of sensation when doing these, but we don't want to do too much, too soon, too quickly, and end up flaring our pain.
Thanks for watching. If you're as passionate about men's pelvic and sexual health as we are, give us a thumbs up, hit subscribe, and spread the word. Let's grow this community together and make pelvic health education accessible to all men and the people who love them.